Everybody, I hope you've introduced yourself to at least one other person as per instructions and not talked about yourself too much and learnt something about somebody you've never met before. Welcome to this session. My name's Meredith and I chair the Fellowship Science Advisory Panel. And hopefully we're going to have an hour and a half or so of very lively debate and get your input, very importantly, to this very important topic, which we'll explain a little bit more about animal behaviourism. So the Fellowship Science Advisory Panel is working on two main topics at the moment. We're discussing net zero surgery and sustainability, which is the other session. And the other big topic that we've been asked to look at by the college is the issue of behaviourism, behavioural medicine, and critically, is it an act of veterinary care, an act of veterinary surgery, and therefore, does it or does it not require regulation? So what we're going to do this morning, the order of play is that very shortly I'll hand over to Ben Myring to give us a little background about the topic, why we've been asked to look at it and how far we've got, which is including setting up an animal behaviour working party, which will be advising the panel. And then we're going to have two 5-minute talks from two speakers, who again I'll introduce just before they get up after Ben's spoken. Sarah Heath and Chris Lawrence. I'm sure they're known to many of you, but I'll just briefly introduce them before they speak. And then we're going to, we want to hear what you've got to think about this. So on your tables, you'll be asked to discuss a couple of topics, and we'll explain what we want you to discuss and how we want you to feedback when we get to that session. So without further ado, I'll ask Ben to come up and give us a little overview of why we're looking at this topic and why we want your input. Thank you, Ben.
Morning, everybody. Great to see you. Fantastic room we're in as well. I wish I lived in a house like this. Just out of curiosity, how many of you here were at Fellowship Day last year? If you could put your hand up. Okay. I promise I'm not going to go on for as long as I did last year, where we were talking about a similar topic. This will be kind of the crib notes version of that, just to kind of remind you of the background of how we got here. So the wider context is that a good few years ago now, we were asked by DEFRA to look at the wider veterinary sector in terms of allied professions, paraprofessions, non-vets, non-veterinary nurses working in the sector, to look at the kind of the exemptions to the Veterinary Surgeons Act that let them carry out certain acts of veterinary surgery in some cases, but also to look at the bigger picture and look at how we might look at regulating them in one way or another. So asking that question of whether the existing voluntary regulation was in place. And we had a working party to look at that, chaired by Bradley Viner, who's in the room. And that working party made a number of recommendations, but it also proposed two potential models for regulation of some of these allied professions. One of those is, we already know very well, that's the associate model. That's how veterinary nurses are regulated. So in that model, the RCVS holds the register for that profession, like the list of names of people, determines what the qualification is, and approves either the schools themselves or the awarding body, and is responsible directly for the code of conduct and so on. So if we were to add additional allied professions in that way, we know how to do this. We've been doing it for a long time. Another model was also proposed, which is a bit more hands-off, called the accreditation model. And that would be where the college could give a sort of stamp of approval, if you like, to an existing voluntary regulator to say, we think these guys are doing a good job. Sort of look here if you want to refer to someone, if you've got a particular case that you want to refer to an allied professional. And it would also hopefully, both of these models, give the public more assurance as to who they can trust when it comes to approaching non-vets for these different things. And we've looked at a whole list of allied professions, such as musculoskeletal therapists and foot trimmers, and more recently veterinary technicians. But one of the groups that we were looking at were those working with animal behaviour. And there has from the start been a question of whether they needed additional regulation to the voluntary systems that they have in place at the moment, and if so, whether the RCVS should be involved. Now, RCVS Council decided to put the accreditation model on one side for the time being to pause it. And the reason for that is that, as many of you will know, we did a much broader review of veterinary legislation that concluded a couple of years ago, called the Legislation Working Party, and the purpose of that was to look at the whole Veterinary Surgeons Act, which is quite a decrepit piece of legislation in many ways now, and say, okay, how should this be reformed? So not just to do with the allied professionals and their regulation, but disciplinary and updating the register and possibly practice regulation and so on. So we've got this big batch of recommendations now, but one of the recommendations that came out of that was that the RCVS should become the umbrella regulator for the vet-led team, that particularly if an allied profession, the paraprofession, and I'll explain what I mean by that terminology in a moment, if they're carrying out acts of veterinary surgery in one way or another, or it could be argued that they could, we should be regulating those. So just like veterinary nurses have got a carve out in the Veterinary Surgeons Act for Schedule 3, we feel that there needs to be something similar for musculoskeletal therapists, for cattle foot trimmers and others, because their work strays into that area. Either it's sort of edging towards diagnosis, or there's something about the actual the actual treatments that they're doing, which could be considered to be an act of veterinary surgery. So we're now very much focused on that associate model, along with veterinary nurses, to create that umbrella regulator. And it could be that sometime in the future, the RCVS would look at that more distant model again. But we did note that when we had the consultation on our Legislation Working Party recommendations, a number of organisations expressed some disquiet about the accreditation model, that it was perhaps a little bit too distant, that the RCVS wouldn't have enough direct control over the sort of policies and procedures of that organisation, and that there were potential reputational risks, as well as it not being a strong enough form of regulation. Behaviourists then. So the question then remains, if we're not using the accreditation model for the moment, should the RCVS be looking at the regulation of the animal behaviour sector? And here's where I apologise for the sort of terminological chaos around this. I'm not a vet, I'm not a behaviourist, I don't work in animal medicine, so in slides that I'm responsible for, and sometimes in speech I'll be talking about behavioural medicine or behaviourism. I don't fully understand the distinction between all of these things, or even if there was, but we've got experts on the panel that will be able to correct me and explain why this very question is meaningless, no doubt. But yeah, that's the question at hand. Is the work that these behaviourists are doing, could it be an act of veterinary surgery? Is either because it's encroaching upon diagnosis, although diagnosis is reserved for vets, but you can argue that something encroaches on it, or the work that they're doing. On one end of the spectrum here is that it's been argued that even by you're deliberately changing the makeup of the brain through these things, and that therefore should be considered an act of veterinary surgery. On the other hand, aren't you doing that when you're training a dog as well? So there's that question then of, can you make a distinction between the medicine side, the clinical side, and the training side? Don't know the answers to this, but we have a working party set up because, as Anna said, the Fellowship Science Advisory Panel has been able to ask to answer this question, so that the RCVS knows whether or not it needs to regulate these people. That's probably enough from me.
Thank you, Ben.
Thank
you very much for setting the scene, and Ben will be sitting here to contribute to the discussions later on. So, as I mentioned, we're going to have now two short talks from two people who are very well qualified to talk to this about you. They're both members of the Animal Behaviour Working Party that we've just described. So I'll introduce them both and then ask them to get up and speak. So our first speaker is going to be Sarah Heath. Sarah is a fellow, and as I said, member of the Animal Behaviour Working Party. She's a veterinary surgeon, recognised RCVS and EBVS specialist in veterinary behavioural medicine. I'm sure she's very familiar to many of you. And our second speaker is Chris Lawrence. Again, probably needs no introduction. Chris has a long and very varied career. You probably know him most prominently for his role as Chief Veterinary Officer of the RSPCA and also Veterinary Director of the Dogs Trust. He says he retired in 2011, but I don't believe him. He seems to be busier now than he's ever been. He's a very busy man and involved still in a lot of charities. He's Treasurer of the Central Veterinary Veterinary Society, but also of great relevance to today. He's chairman of the British Veterinary Behaviour Association. So without further ado, I'll ask Sarah to stand up and give us a brief introduction to the topics we're going to be asking you to discuss further. Thank you very much, Sarah.
Thank you. Okay. Is this the advance of that? Oh, there we go. So it's a bit of a technophobe. Sorry about that. Okay, so I've been asked to just give a little bit of information looking at what we're doing within the working party. And there are two remits, if you like, that we have within the working party. This is definitely struggling. Okay, so the objectives then of the working party, and the two things I want to just mention today are, first of all, we're thinking about how we could develop a position whether any aspects of various roles, and that's the bit that's a little bit important, various roles in the animal behaviour sector could be defined as acts of veterinary surgery. And then from that, whether or not the RCVS should have a role. And you can see from those two objectives, they are inextricably linked with each other, because as soon as you answer one, that influences the other. One thing I think is really important to point out is that at this stage, we are not being asked anything about standards. This is not about who should be involved in standard setting or what those standards should be or anything like that. It's far more broad than that. It's about whether or not it's an act of veterinary surgery, therefore whether RCVS should be involved. And as we know, there are at the moment quite a lot of confusing aspects to the animal behaviour sector, and voluntary regulation of that sector is a little bit confusing. I am going to mention an organisation here, having just said this is not about standards. The only reason I'm putting this Animal Behaviour and Training Council list here is because that organisation does have the different roles defined. So again, nothing to do with standards, just about the roles. And so you can see there are a lot of roles here: animal trainer, training instructor. So animal trainer being influencing the animal directly, animal training instructor about getting caregivers or those involved with the animals to be able to train, so there's a human element to that. Animal behaviour technician, which is a term that again is slightly confusing, because obviously in the States the technician, behaviour technician, means veterinary nurse very exclusively and specifically, whereas this is not meaning exclusively veterinary nurses, but it's talking about people who are working at that level of support of the veterinary team, and there would be many veterinary nurses who would fit into that sort of level. The accredited animal behaviourist is no longer open to registration, and then we've got the clinical animal behaviourist, veterinary behaviourist, and expert witness. So if we just look at those roles, I think we can divide them in a way based on this issue of health, and that's really where I'm coming from to this question. And you'll notice I've put there aspects of the health triad. We know that the Veterinary Surgeons Act, of course, is quite old, and that in the 60s, when we had that piece of legislation, even in the human field, health was pretty much confined to thinking about physical health. We've moved a long way from that position in both human animals and non-human animals. And we now recognise that health is far, far broader than that. So it's physical, it's emotional, and it's cognitive. And those three parts of your health cannot be separated from each other, because they all influence one another. So when we look at the animal trainer or animal training instructor, the role there is to be looking at influencing behavioural responses in healthy individuals, rather than those who are presenting, if we look at the other three, where there's some form of compromise within one or more aspects of that health triad. And the fact that the health triad impacts on each other means that even though you may have only a compromising in a physical health sector, that could influence the behavioural output. So it kind of brings me to the next point, which is this one as to whether the RCVS should be playing a role, hinges on whether it's an act of veterinary surgery. So if we look at the health triad idea, the idea that veterinary professionals are responsible for healthcare starts to become a much broader issue if we recognise that health is a triad. And of course, traditionally, we have been more concentrated on physical health aspects, and we still are to a large extent in our veterinary education, both our veterinary surgeon and veterinary nursing education. But we do recognise more increasingly that they're interrelated and we can't consider them in isolation. And that disease can exist in any aspect of that triad. So let's look at the Veterinary Surgeons Act and the most important parts here highlighted in bold. The diagnosis of diseases in and injuries to animals, and then the giving of advice based on such diagnosis, and then the medical and surgical treatment of animals. I've highlighted medical there because of thinking about behavioural situations. We are less likely to be thinking about the use of surgical techniques, not necessarily never, but it would be more unusual. So I think if we look at that definition in the light of the health triad and moving on as to what we believe veterinary healthcare means, it makes sense that clinical behavioural work and behavioural medicine are acts of veterinary surgery. Behavioural medicine is easier because that's a veterinary discipline. And so I don't think there's as much controversy around that because behavioural medicine is something that's practiced by veterinary surgeons, so it is already encompassed within the profession. Of course, we are not the only profession responsible for non-human animal healthcare, and that makes absolute sense. Neither is the human medical profession the only profession responsible for human animal healthcare. It's too complex to be held within the hands of one profession. So we need a multidisciplinary approach, but we need to think about safeguarding welfare, particularly of our non-human animal species who have different ways of communicating. So I'm not going to say they can't tell us how they feel, because they can, but they use different dimensions to communicate that. And that gives us, as veterinary surgeons, a very specific role in protecting their welfare, which is why I believe that a vet-led team is so important. And I feel that that bit is most relevant to clinical animal behaviourists and animal behaviour technicians. The regulation within veterinary surgeons of doing behavioural medicine, as I say, is much, much clearer. So this would be my summary, that behavioural concerns are the things that caregivers or members of society or legal institutions bring to someone's attention. And it's about what the animal is doing. That is why someone will raise a behavioural concern. But if you're going to go on and modify that in any way, the more important question is, why are they doing it? The what is purely a sign or a symptom, which we're very familiar with as veterinary professionals. So for some, that behavioural output of the why is related to natural species-specific behaviour in a healthy animal, cognitively, emotionally, and physically. And animal trainers and animal training instructors are involved in those cases. But for others, the why is related to disease in one or more aspect of their health, one part of that triad or multiple parts combined. And therefore, a vet-led approach is necessary, and it's the clinical animal behaviourist and animal behaviour technician levels that would be involved in that. In order to reach a level of a diagnosis on which you can then give advice and treatment, then by definition, according to the Veterinary Surgeons Act, that is an act of veterinary surgery. So answering that question then leads to, yes, if there's an act of veterinary surgery, the RCVS would have a role in the regulation of that work. Thank you.
Thank you very much, Sarah, for explaining that so clearly and concisely. Okay, over to Chris now. 5 minutes from you, please, to talk to us.
Thank you. If I may start off by misquoting Shakespeare, Mark Antony at Julius Caesar's funeral said something along the lines of, "I come not to disagree with Sarah, but to enhance what she said." This is roughly what I want to cover today. I am largely talking on behalf of the Animal Behaviour and Training Council, because I'm a trustee of that, and we're doing a lot of work on these issues. So, Sarah's already touched on this. These are the standards that ABTC has written after very wide consultation about what these particular roles do. And there are summaries of each of these standards that show exactly what field they're aiming at. They require some underpinning knowledge, but above all they need a practical assessment of their competence. And the bottom line for the ABTC is that these people, once qualified, have proven their competence to do what it says in their standard. And that is a key issue for me, that somebody who wants some behavioural advice, whether it's how to train their puppy or whether to deal with some problem like aggression, they need to be able to go to somebody who has proven their competence to deal with those issues. And that is the key tenet of what ABTC does. So underpinning knowledge, which may vary depending on the roles, a practical assessment, and then a CPD requirement after that. And you'll notice that this is very much mirroring the procedures that Royal College has. We have worked very closely with Royal College during this discussion about the accreditation model and the associate model. We were very pleased that the Royal College was picking up the accreditation model because that's exactly where we wanted to go, and we were very unpleased when Council decided, at least at the moment, to drop it. Sorry, I pressed a button somewhere. In the light of that, we do think that there needs to be some external quality assurance for what we're doing. And as a consequence for that, we are at the moment going through the process of getting accreditation by the United Kingdom Accreditation Service. Not a body that you may have heard of before, but essentially they implement British standards for people doing things. So if, for instance, you have a gas fitter come to put your gas boiler in, if you can get away with it before we all have to put in air source heat pumps, that gas fitter will have had their competence proven by a UCAS accredited organisation. So that's what UCAS is about. The same applies for to people like MOT test technicians and so on and so on. All based around British standards. So why do we need all these people? Well, you don't need me to tell you that the incidence of dog bites is going up. And I'm not going to get into the XL bully discussion because we will be here all day if I do. But it is very clear that the whole spectrum of training, from an individual training an individual animal to an animal training instructor teaching a dog training class, all the way up to the top end of the spectrum, is critically important. And the pandemic puppies research that was done at the Royal College has shown how much the effect of the lockdowns has had on that progress because of lack of socialisation of puppies when they're in that very important socialisation stage. So our view is that there is a continuum all the way through this that affects and indeed modifies the behaviour of an animal. And that doesn't matter whether you're teaching a dog to sit or walk on a lead or whether you're dealing with an animal that is showing aggression. And it is, in our view, impossible to put a dividing line anywhere in those. So yes, it could be an act of veterinary surgery, but it is not necessarily so. And when you're dealing with the more severe issues, the importance of veterinary screening to rule out physical disease is really critically important. So, as an example, a clinical animal behaviourist would not see an animal until it had already seen a vet to rule out any physical issue. And of course, pain comes top of the list of those. So, this is what we have in place. This is the system. If you go through an ABTC registered process, you go off and either do a course or you come and prove that you have the necessary knowledge through assessed prior education and learning, that's APEL. So that looks at what people have been taught and interviews them to make sure that they understand what they've been taught. Then a mentoring process, supervised practice, and ending with a practical skills test. That then proves that the person doing whatever role it is of the ABTC roles is competent at what they're doing. So, just as an example, why do dogs pull on the lead? Well, it may just be that they're badly trained. As an example, 18-month-old golden retriever, perfectly healthy, perfectly fine, put her on a collar and lead and she will pull until she chokes herself, almost. Now, why is that happening? Is that simply because the dog was poorly trained, poorly socialised? Is there a physical and mental issue there as well? So it's not easy to compartmentalise one act of veterinary surgery from an act which is not veterinary surgery. So diagnosis and assessment are critical to that process. We live in a very different world in the veterinary profession to what happens in the human professions, where in human professions there are very well set out diagnoses and parameters to reach a diagnosis. So, for instance, autism. That is clearly defined. We don't have that in veterinary medicine. You need clarity if you're going to try and differentiate between these two. And clearly, if we are going to, as ABTC would argue, regulate all of these professions, the whole sector, then we need new legislation to do that. And we're entirely behind that. We need to be able to differentiate what each of these roles can do. And it does beg the question of what we do with existing practitioners. There are thousands of people out there calling themselves trainers and behaviourists. I can go on a weekend course, spend 2 days on virtual lectures, come back and call myself a behaviourist. And there's nothing to stop me doing that at the moment. And that is a major issue. And if you watch some of these horrible people on the television, Caesar Milan, the dog daddy, if you watch any of their videos, you'll see how appalling their processes are. So it is impossible, we think, to clearly delineate the roles. If you can't clearly delineate the roles, how then are you going to enforce what is an act of veterinary surgery and what is not? We need to come, the chances of government protecting the title behaviourist or trainer, in our view, is about nil. If they're not going to protect the term veterinary nurse, and clearly they should, the chances of them protecting the term behaviourist or trainer is very low. So we can still put in place some regulation. We need the Royal College to do that. That is clearly some way away, and the UCAS accreditation that we're going for will enhance what we're doing in the meantime. We do need to come to a conclusion about existing practitioners. There is perhaps a model there from the 1948 Act, when people who are acting as vets, calling themselves vets, but were unqualified, were taken on as special veterinary practitioners? Can't remember. I'm looking at Ben. You're not old enough, are you? Sorry.
Bless you.
Veterinary practitioners, thank you, Bradley. But we need to underpin that by agreeing standards. We need to underpin that by proper assessment, and we need seriously to consider how this can all be enforced. Thank you very much.
So thank you. I hope that's really set the scene and given you a lot of food for thought. You can see that it's a complex area, and as Chris said, at the moment there is just one really sort of overarching voluntary organisation involved with this. But we've got to go back to those two key questions that Sarah emphasised at the beginning. Obviously, you know, hopefully, if you didn't already know, a bit more about the ABTC system and the standards. But what we really want to focus on this section is those trying to get a bit of clarity and a bit of feedback from you as fellows on those first two questions. So the idea now is that we're going to go into breakout groups, and those are simply your tables. And we'd like you to answer these questions, and we'll leave this up throughout the session. So on your tables, we'd like you to try and answer these two questions. Basically, behavioural medicine, is it an act of veterinary surgery? And you might want to thinking about that in terms of, you know, the definition of diagnosis, and can you separate animal training from behavioural medicine, as Sarah was talking about, or is it really this spectrum that Chris was talking about, where we really can't make any divide? So that's the behavioural medicine question. And then, if so, as we've already said, one leads to another. If it is an act of veterinary surgery, what do we do about regulation? So some things to think about there. Now, we are quite limited for time, and really the idea of this session is just to not come up with any definitive answers. It's to get an assessment of some thoughts and feelings from you that we can then feed back into the ongoing work of the working party.
Anna, can I just say one thing? Sorry, before
Yes,
we get
please
further. That terminology, Ben and I had this conversation just before. Yes. Behavioural medicine is a veterinary discipline. Yes. So I think we have to be really careful with that terminology, and maybe clinical animal behaviour or... Behaviourism, I think what we put on it, but we didn't like that term. Practical applications of animal behaviour. Do they involve acts of veterinary surgery? Because behavioural medicine is a veterinary discipline. Yes, thank you for pointing that out. That's very clear, and I think you made that really clear in your slide. So thanks for clarifying that. So what we'd like you to do, we've got 3/4 of an hour, so what we'd like to do is let you speak amongst yourselves, have a lively debate for as long as possible. So I would like to suggest that we go for, let's say, 25 minutes discussion time, which will leave us 20 minutes to get a bit of feedback from each table. If you could just nominate or volunteer one spokesperson per table, so we have 5 tables. And then when we finish at 20 to 1, we'd like your spokesperson, we'll just go around and get a quick feedback from each table about what your key thoughts on those two questions are. When we get to that stage, I'd request that we don't just repeat, you know, it's fine to say we agree completely with what's been said before, because we've only got about 20 minutes to wrap up the session and get the sort of key messages from your feedback. How does that sound? You've got a piece of paper and pens. As I said, the idea really is to get you talking about this really important issue and getting some feedback for the working party to continue their important work. So I'm going to leave you that. We will be circulating, Sarah and Chris will be circulating, Ben will be circulating. If you've got any questions or queries about technicalities, do raise your hands and shout, but very much an interactive, fairly informal session. So off you go, and I'll call you to order at 20 to 1. Thanks very much.
Go clockwise and I'll go anti-clockwise.
Whatever.
How do you want to do this?
That organised, I'm just going to randomly wander. But if you want to do it with knife,
Thank you. So we were, as predicted, we went 15 minutes into 30. Thank you. No, it's fine. It's fine. It's always the way. Yeah. I think 20 minutes, 25 minutes. 25 minutes is a long time.
Yeah.
So,
I think we can see that.
yes.
Well, good.
Not insurmountable. Not insurmountable. There's always common. There's a common ground. There isn't. We can just. Well, we will get there. That's why we have a working party.
Yes.
And it's important. To acknowledge those differences, and that's the whole point, is to come up with a really informed conclusion.
A standard description of cats and dogs. It's a considerable like bit of each one.
I will emphasise that again. I've emphasised it once.
It will, but we've got to do it in a bit of discussion. It's just...
Yeah, and is that particular system fit for purpose and can be adapted to whatever. Which was that? Oh, right, sorry. Yes.
But not until we're reformed.
No, that's what, yes, I really want to focus on that, and that's not what the Working Party's remit is. So thank you for really emphasising that. I will try and bring it. So my best,
I say in for a bit.
I don't want to have 5. Yeah, we'll see what it's like. 5 spokespersons, that will probably take a good 10 minutes. And then I think
we're circulating. No, we're circulating.
Because I'm not the expert here, so I'll ask.
I'm not taking my coat off because I'm not stopping.
Just so you make sure you're getting the phone.
No.
That's all we can hope for. It's just a chat.
I think it's useful to have a chat to hear
What other fellows think.
Have they even thought about it?
Probably not. So a lot of people are here. So that's a good clue.
That's good.
It is good.
They're absolutely
But what I don't want to have is if we can avoid.
See, I think Sarah's point that what you're doing is modifying the way an animal's brain works. Applies whatever stage you're at, whether you're teaching your dog to sit or whether you're dealing with aggression because it's fearful. So it is an act of veterinary, there's any question about that. It's where that dividing line is and whether you can actually define it. Because if you can't define it, how can you enforce it? If you can't enforce it.
And ultimately, the other thing is, the Working Party informs the panel.
Psychiatrists and psychologists. See, that's my other point, is that they all have definitions of all these, if you're bipolar, then there's a written definition of what a bipolar person is. We don't have any of that in veterinary medicine. How's the Royal College? Yeah.
Come and listen to you.
Been told to just sit at tables. Earwig.
No accreditation for therapists at all. Human therapists, none at all. So are you saying it isn't? Because yeah. Well, no.
Okay, everybody, that's 20 to 1, so I want to make sure my key role is that you get to your lunch on time. So we have 20 minutes now to get a bit of feedback, and it's been great to see so much interest and discussion, and probably lots more questions than answers. So just to reassure, we're not looking for the definitive answers today. We're looking forward to opinions, thoughts around these 2 questions. So if you could try to focus your answers quite succinctly around these two key sort of question issues of, is behavioural medicine behaviourism? We know about behavioural medicine. Is behavioural therapy, work or any aspects of it an act of veterinary surgery? And then if so, what's the role of the Royal College in potential regulation of it? So, as I said, we've only got 20 minutes, so try and keep it fairly brief. And if your opinion is exactly the same as the table before, just say that. You don't need to repeat it. So we want to try and get as much feedback and opinion as possible. So I'm going to sit down and just ask each table to give their feedback, and I'll probably refer to the 2 experts or the 3 experts to answer any queries or comments based on the feedback. So this table here, who's your spokesperson? Would you like to just summarise your discussions?
I don't want to go first and steal everybody else's thunder, so
That's
I
great.
won't say
It's always a good
everything.
way to be.
So we had a number of questions. We were exploring the sort of continuum and where the boundaries might lie between harm and learning, shall we say. The question that struck me actually was really interesting was to go back to RCVS and from the regulator. So what are the biggest fears here? What's being worried about? Why are we talking about this? We did agree that a lack of regulation does potentially pose a risk to health and welfare. Questions around, can the RCVS influence UCAS in any way? Is there a relationship there around the accreditation that Chris was talking about? And then what might be the unintended consequences of any regulation?
Thank you. Any comments? I'll go to you, Ben, first for the sort of more the Royal College question aspects of that. More questions really than
So yeah, the core purpose of any regulator is to uphold standards and to protect the public and the public interest in some way. And in this particular area, with all of the allied professions, it's that there is at least some evidence that there's that both there are benefits and harms, benefits and risks that come from these allied professionals doing their work. And there can be very great benefits when you have people that are properly trained working in that vet-led team model, but risks when poorly trained or untrained people making spurious claims are doing stuff. So the question then becomes, is the sort of voluntary regulation system sufficient, or should the RCVS step in some way? And that's what we're considering doing here.
Okay. Any other quick comments before we move on any of those?
No, just to say that ABTC is not blind to what the standard contains. It does have technical advice to make sure that's right. And if we're going to go down this accreditation model, clearly there'd have to be some role for Royal College in there looking at what those standards say. But they're reviewed every 3 years, so that's a very simple process.
Thank you very much. Table at the back there. Do you want to comment on the outcome of your discussions?
We had lots of interesting discussions, but I'm not sure we came to fantastic conclusions, I'm afraid.
Don't worry,
we've got two very quick answers to question 1, does it matter? And to question 2, yes. So I think what to expand a little bit, we think that regulation of this area is important, and so does it matter whether it is an act of veterinary surgery or not? The bottom line, though, which we talked about a little bit, does it matter if it's not enforced? Because there are obvious acts of veterinary surgery that seem to be happening in the country now, and that is not being enforced when they're being done by non-vets. So we can spend an awful lot of time and go to a lot of trouble to create these sort of regulatory frameworks, but without the will and the means of enforcing them, then it might all be a waste of time.
Thank you very much. So I'm going to ask Sarah and Chris to comment. Sarah first, does it matter?
I think, can I go to the end first and then come back to the beginning? So I absolutely empathise with your viewpoint and was having this discussion with other people on other tables as well. I think the biggest frustration is, can it be enforced and will it be enforced? And I think there are many of us in the profession who are at the moment quite perturbed by acts of veterinary surgery being carried out in other spheres without regulation. So I think that is hugely important. Unfortunately, what the working party has been asked to look at is not that. And there has to be, it's a bit of a chicken and egg thing. Where do you actually start this process? Because it is a cycle. And so do you start by saying, well, if we did something, can we enforce it first before we decide whether to do it? Or do we make a decision to do something and then ask how are we going to reinforce it? And I guess there's a way of doing that this is a working party, that actually the fellowship scientific advisory panel is just that. It's an advisory panel. It doesn't have any clout. It can't do anything. It's advising. It's actually the Royal College who will be the ones who do anything if anything is done, if that makes sense. So at this point, the working party in terms of the fellows is to discuss whether or not those two questions, is it an act of veterinary surgery and does the veterinary profession have a role? And then before it is actually done, I agree the next question is, if we do it, will it be enforced? Because, and I agree with you that that question needs to be asked at that point in the proceedings, not we make a decision, we do it, and then we go, oh, can we enforce it? Because that is an issue in other areas. It's been shown already to be an issue, so I agree with you on that. But it's the order in which these things are done.
Chris, did you want to comment on that? Or?
Just to add to that, without legislation, enforcement becomes impossible. But if you have legislation and the accreditation model, then it comes with an enforcement process.
Okay. Did you want to comment on that?
Yeah, I think I do. Yeah, I'm actually not sure I agree with Chris there. I mean, you don't need legislation to have an accreditation model, that more distant sort of stamp of approval bit. What that would do would be to give vets and the public somewhat more confidence around the processes that an existing organisation has in place. New legislation would give a statutory regulator more powers, i.e. the RCVS, or a brand new regulator for animal behaviour people, which I think is extremely unlikely. It would be the RCVS that was doing it. And the RCVS would have largely the same enforcement powers that it does now for acts of veterinary surgery being carried out by others. I think, I mean, mostly it's a matter for the courts if somebody breaks the law. But there's one bit that I think is often not thought about so much in these conversations, and it's sort of withering on the vine bit, right? So if you say, okay, new legislation gives you a protected title, whatever that might be, let's say it's the clinical animal behaviourists in this case, and the RCVS defines what that role does. And a vet can only refer to somebody to do that stuff if they are on a register of people with that title. There will be some existing practitioners that you would want to grandfather in, give them that title or a related one for a period of time, just as happens with veterinary surgeons, say. Now that wouldn't be an instant catch-all, solve the problem thing. You would still have some people out there doing stuff that they shouldn't be and so on. But over time, there would be, those people would, to a certain extent, and I think a large extent, wither on the vine, because the public understanding of who the trained people would grow, just as it has with veterinary nurses and indeed veterinary surgeons. People would be less likely to go to somebody that wasn't qualified, and vets would know who to refer to and delegate to, so they would have more confidence. It would be a big step in the right direction, but there's never a perfect solution to wrong-uns, but there's a lot that we can do.
Thanks, Ben. Okay, table in the middle there. What was the outcome of your discussions? I'm hoping someone's going to ask, is it an act of veterinary surgery? No one's actually tackled that one yet.
Yeah, my group took the slightly novel approach of not really addressing the questions directly. and I made the mistake of sitting next to the pens, which I won't do next year. So we talked about general principles and outcomes, and saying that really we're interested in the health in the broadest sense of the animals, their welfare and their behaviour, and also protecting public safety. And the question was asked really whether or not, what impact regulation would have on the delivery of these things, because, you know, these matters could get lost in a lot of politics and administration and acronyms and difficult decisions. We talked about blockers to the owners actually consulting vets and the profession on these issues, and that if we are protectionist about this and we have some sort of arrogance and make this a vet-led thing, then the fact that some owners can't afford veterinary fees, or that they're worried that the vet might judge them badly because their dog's of a particular breed or poorly behaved, could actually be a blocker to the delivery of good welfare and good public safety. And also the issue of whether or not vets really, really want to be the people who are in charge of this, because it's not to everyone's taste, this area of the profession. We then did sort of, with some urging from me, drill down a little bit into the questions. And one of the things I think we were really concerned about is, what's the cut-off point? Is there a regulatory threshold? We all accept at one end, and it's very easy to see this, that dog trainers are probably different kettle of fish and not really likely to be subject to regulation, whereas at the other end, if you get an animal that genuinely has a, what would you call it, an emotional health issue, then that falls more squarely into the realm of the veterinary profession. Now, somewhere along that spectrum is the point at which we regulate, and the sweet point really is the one that we need to find. And I think that really would answer, in some ways, some of the questions that are posed on the board above there. Thank you.
Thank you very much. Thank you. I'm conscious of time, so I'm going to skip your comments and just get the last two tables' feedback, and then if we do have a few more minutes, we can have a more general discussion. But table at the back there, do you want to share your thoughts with us?
Yeah, thank you. Unlike the other tables, of course, we did stick strictly to it. Or at least we came back round to it for a minute or two at the end. I think that there's clear agreement that behavioural medicine or behaviourism is a spectrum, and there's some point at which it crosses that boundary into veterinary medicine. And I think the key question in the first part is an assessment, and the difference between an assessment and a diagnosis. And that was considered by the working party that I chaired. There are other models, so for example, osteopaths are a regulated body, and they are expected to carry out an assessment, not a diagnosis of back problems, and would then be expected as part of their regulatory framework to refer that on, to recognise what needs to be referred, and to refer it on to a medical practitioner if that's needed. In terms of regulation, I think the important questions really are, or the answers that we felt were important were that, yes, there is a risk to animal health and welfare from unregulated animal behaviour, therapy of any sort. I suppose what we did debate then was whether the RCVS regulation would benefit the sector, and also the question of whether regulating the sector puts the reputation of the Royal College at risk if it's not well regulated subsequently. But it would be possible for the Royal College to, under its existing charter powers, to regulate the whole spectrum on a voluntary basis. It doesn't require a protection of title. In the same way as, for example, a specialist, somebody can call themselves a specialist. It's not a protected title, but they can't call themselves an RCVS accredited specialist. So in a similar way, you could have professionals who are RCVS behaviourists at whichever level accredited, and how would that benefit the system? Well, to some extent, the public might recognise that as a worthwhile stamp of approval. There was some debate as to how effective that would be. But, as you mentioned earlier, we could also regulate the manner in which veterinary surgeons then refer cases, and perhaps could restrict that referral of cases on to allied professionals who are regulated within that same framework.
Great, thank you. Thank you very much. And thank you to the people who contributed to that discussion. Last but not least, this table here. And then
much like our esteemed colleagues over there, we did try and answer the questions. We felt fairly unanimously, I think, that it is an act of veterinary surgery, and we felt that assessments by non-vets do approach the definition of diagnosis, because animal behaviourists who aren't vets are diagnosing problem behaviours. We feel that it is a massive issue to potentially to animal health and welfare, so it should be regulated. But we felt that, again, as has been said, I won't repeat too much, but we feel there is a line between training and behaviour, but that training methods also should be regulated or accredited or somehow, because they can have a massive negative impact on the likes of Cesar Milan and other trainers who, particularly I've done a lot of work in gun dog areas, trainers who are still using punishment-based training methods, and that has a massive potential impact on that animal's health and welfare going forward and its relationship with its owners. So we felt that one thing that would be good to start with is to say we suspect that a lot of people aren't having vet checks from behaviourists, from vets before they go to someone like a clinical behaviourist. So concentrate on enforcing that, regulate that part of it, and then that will then hopefully filter down to, you can always come back to this on a regulation review at a later date and say, well, where does the training fall in? Does it have to be regulated by the same body? But we felt it should be regulated, whether it's the RCVS or not. But the tiers above that are clearly behavioural issues should be an active veterinary medicine. Is that fair?
Well done, thank you. Okay, we've got a minute to go. We always knew this wouldn't be long because there's so much to talk about. But would anyone else like to just chip in or make any other comments? And then I'll maybe ask Chris and Sarah just to give some final comments. Any other comments or, part of the discussion? Frida, yeah. Is there a mic for Frida? Sorry.
I thought the discussion we had round the table, which, Anna, you joined in for some of it, was actually quite interesting because we strayed into equine behaviour. And then, of course, inevitably we strayed into equine dental technicians, which those of you who have been around a long time know there's a huge amount of controversy about their actions and their regulation and everything else like that. But it did occur to me, as a strictly not equine girl at all, that there's been a way forward since I was heavily involved in it 20 years ago when I was BVA president. And it seems to me that, we might have an ability to look at another technique or, sort of skill that we might learn from and look at how they've managed that. And it was just quite interesting. And I also learned today that there are 5 equine behaviourists, which I think is really interesting.
Thanks, Frida. Does anyone want to come back on that? Or yeah.
I'm glad Frida brought that. I think I just shouted. One of the things when I do the stuff with extreme conformation that I get very frustrated with is that everyone only ever talks about dogs. And there are so many behavioural problems with cats and rabbits, and we neglect animals' behavioural and social needs so much and concentrate on their physical well-being. The whole triad thing I love. And if this does happen, can you please make sure that people start talking about other species?
Yeah, thanks. Very good point. And I would say we have got an equine behaviourist on our working party. I think that's really, really, really important.
Rabbits and cats.
Well, I'm there for the rabbits. I'm really sorry, we're going to have to be strict about time. We're going to have to wrap up.
I'm really hungry. So
yeah. So thank you all. I hope it's given you some food for thought anyway. And I'm just going to ask Chris maybe a couple of sentences from you and a couple of sentences from Sarah. And then I'm just going to put one final slide up to say, please continue this conversation. So Chris, just some summary thoughts, please.
Okay. Well, I think 3 points. One is, I don't think anybody disagrees that some acts of behaviourism are veterinary surgery. There's no ifs or buts about that. Yep. The problem is defining it. And until you can define it, you really shouldn't regulate it or attempt to regulate it. The second point about welfare, that's the bottom line for me. The welfare damage that's being done to some of these animals is enormous. We have been collecting case studies for the consequences of some of the stuff that's done. And believe me, it is across the entire spectrum. So it's as much the animal trainer and the animal training instructor as it is the behaviourist doing harm. And welfare surely should be our bottom line.
Thank you, excellent. Sarah?
Shout out for cats and rabbits with you. So absolutely, this is not, shouldn't be species specific, and I don't think it is in terms of the working party. I guess my point is that we've moved a long way from this definition of health from when we had our original Veterinary Surgeons Act. And actually, the Veterinary Surgeons Act does not say it's not emotional and cognitive health. It just doesn't mention them. It says health. It doesn't say physical health. So that's the really important part, to think about health in its entirety. I like this table, we're making this differentiation of timing and maybe not saying never to the more prophylactic approaches. But I think there's such an urgency that we do need to be concentrating on the clinical animal behaviour level at the moment, and looking at regulation of that because of the consequences.
Thank you very much. So, as I say, thank you all for your participation. What we would like, if you do have some strong views or want to obviously continue discussions over lunch or come and talk to any of us, as I say, Chris, Sarah, myself on the working party, you can give your feedback. But also please do email us as well if you say it's about behaviourism, or your comment, or you feel you really wanted to say something today, or come up with some thoughts on the train on the way home today. Please do feed that back in. And watch this space. Obviously, the working party's got a really important job to do, and the advice it's going to give back to the Royal College through the Science Advisory Panel is going to be critical. And we've had one meeting, we've got 3 more meetings, and a year. Well, it's less than a year now to come up with something. So watch this space, and thanks again for your input, and enjoy your lunch and the rest of the day. So thanks very much.